Good afternoon, and thank you for joining us for another Facebook Live discussion here at Peter Mac. My name is Susanna Lyons and I'm part of the Peter Mac communications team. I would like to start by acknowledging the traditional owners of the land on which we are meeting today. Here in Parkville, the traditional owners of the land of the Kulin Nation, and across all the locations from which you are joining us. I pay my respects to all elders, past, present, and emerging, and acknowledge any elders who are joining us today. Earlier this month, on February the 4th, was World Cancer Day, a day when we consider what we're going to do to work towards a cancer-free future. During the COVID-19 lockdowns last year, Peter Mac saw patient referrals for cancer treatment drop in some areas by as much as 40%. So through community engagement initiatives like this one, we want to reiterate the importance of timely cancer diagnosis and care. And we're very lucky to have two experts to speak to and to answer your questions today on this topic, on the topic specifically of skin cancer. And of course, if you have specific questions on this topic, you can either post them on the Facebook post, or we're also broadcasting live via YouTube. So again, a comment under the YouTube video, and we'll hopefully get the opportunity to answer some of those questions later in the session. As I was saying, our guests are both experts on skin cancer, although they approach this topic from different ends of the spectrum. They're also long-time collaborators, so I'm interested to hear a little bit later what they've learned from each other over the years. But what they both share is a passion for promoting the importance of skin cancer prevention and early detection. Our first guest is Dr. David Koch, who is a radiation oncologist here at Peter Mac. He primarily specialises in the treatment of skin and neurological malignancies, but also treats other tumour types as well. David is also the course convener and academic lead of the Master of Cancer Sciences program, which is run in partnership between the University of Melbourne and the Victorian Comprehensive Cancer Centre. And joining us, a special guest from Cancer Council Victoria is Heather Walker. Heather is head of the SunSmart's program, which is the state's skin cancer prevention and early detection program. She is a subject coordinator on the Master of Cancer Sciences program and also contributes to the World Health Organization Collaborating Centre on UV radiation. Heather's background is in cancer policy in the UK, where her work resulted in better government decisions to improve cancer outcomes. Welcome to you both.
Thanks for having me.
Thanks for having me too.
If we could start from the beginning, perhaps, David, when I hear the phrase skin cancer, my mind immediately jumps to melanoma, but I understand it's a broader term than that.
Yes, that's right. So I guess in principle, skin cancer is really referring to any cancer that has started in the skin. And there are a few really common types. Melanoma is kind of one of the headlines of those. Two of the other more common types you might have heard of are squamous cell cancers and basal cell carcinomas. Those are probably your top three, but there are actually a whole bunch of other more minor ones too. So it's sort of it's a catch-all term referring to a whole group of cancers.
And Heather, why is skin cancer one of those particular concern to Australians?
Yeah, just to add to what David said, so it's of concern because it's still such a big issue in Australia, essentially. And when it comes to the non-melanoma skin cancers, they're the less deadly, but the much more common type of the disease. And there's more than 1 million treatments for those in Australia each year. And it's estimated that there's more non-melanoma skin cancers diagnosed than there are all the other cancer types put together. When it comes to melanoma, we expect to see around 16,000 cases in Australia each year. And we're still seeing around 2,000 deaths from all types of skin cancer in Australia each year. So it's still something we need to pay attention to.
Still huge numbers. And I was reading somewhere that 2 out of 3 Australians will be diagnosed with skin cancer by the age of 70. So,
yeah, that's right. So it's just a huge issue. And thankfully, most of those will be the less deadly types, so the non-melanoma skin cancers. But these still place a huge burden on the health system. So prevention is always better than cure.
So David, what are the early signs of skin cancer that we should be looking out for? I've got 1,000,001 freckles, but, how do I know if one freckle may not be maybe masquerading as a freckle and, should be something more serious that I should get checked?
Look, at the very basis, Susanna, what we usually tell people is we ask people to look for change and things that they weren't expecting. So the most common things are lumps and sores. That's what we usually talk to. So if something is getting bigger, changing colour, getting sore or tender, or if it's actually forming an ulcer and bleeding, itching. Those sorts of things are all signs that are unusual and would normally prompt a person to have a little bit of a question in their mind about what it was anyway. And that should seek someone to go out and get a professional opinion about it. Not everything is skin cancer, of course, but to be able to identify definitively, it's best to have that properly assessed.
And sort of a question, I suppose, for you both, what are the factors that might mean a person is at higher risk of developing skin cancer? Like, I describe my skin color as pale and interesting because I never tan. And if I, spend too long in the sun, I will go from pale to lobster in about 5 seconds flat. But what are the other common risk factors, across all different types of skin types that people have?
Well, there's a few actually, and you've nailed one straight out of the gate. So absolutely, there's skin types which we know are far more likely to get skin cancer, and those are people who have pale skin, often the red hair type. So, and those people will sunburn more easily and will often be aware of that. So a history of sun exposure, which clearly has a strong relationship with skin cancer, which we might talk a little bit more about later. So people who have spent more time in the sun over the years. Then there are other things like family history, which come into it. So if you've previously got members of the family who've got skin cancer, or you yourself have previously had a skin cancer, then that raises the risk. Heather, you might want to comment a little bit about factors like age and gender and how that comes into it.
Yeah, so cancer in general is a disease of ageing. Thankfully, with melanoma, we've seen rates go down in the under 40 age group since SunSmart came along in the 80s. So there is progress being made. But for older people who might have been exposed before the messages were out there, certainly something to bear in mind. And then a really interesting point that not everyone might be aware of is that twice as many men as women die from melanoma in Australia every year. So that's huge, and it's almost entirely preventable. So at SunSmart, we've developed a campaign that's on air at the moment, specifically targeting men to remind them of the dangers of UV exposure.
And why do you think it is that more men die from melanoma than women? Are they less careful? Like, I hate to make gross generalizations, but, what has your research shown you is maybe leading to that discrepancy?
So there's a couple of things. Firstly, men tend to be outdoors more than women. Actually, males at all stages of life tend to be outdoors than females. And if you think about, say, workers outdoors, tend to be male rather than female. And then they tend not to protect themselves as much. So it's a combination really of those things. The other thing that might be coming into play as well is going to the doctor and getting checks. When there's something on your skin that looks new, unusual, changing, men might be a little bit more reticent about going to the GP. So that's another really important message, particularly for men, to make sure they go as soon as they notice anything new, unusual or changing.
Yeah, and in particular, I suppose, in the context of what you were saying earlier, Susanna, I mean, we know that generally at the moment in the setting of COVID, then people are seeking medical advice less. So whether that's going to exaggerate that effect in coming years will be interesting to see.
And that's something at the Cancer Council, we have the Cancer Registry based with us. And they found that their notifications to the registry of melanoma went down by 30% in the first lockdown. That wasn't even the long lockdown that we all so that just heightens the importance of getting stuff checked as soon as you notice anything wrong.
So because I'm a science nerd, and I'm sure there's other people watching this as well, what is actually happening, at the cellular level, if you will, with UV radiation, and what is it doing? What is it, first of all, and how does it cause skin cancer?
So the sun gives out different types of energy. So heat, which we can feel, light, which we can see, and then UV, which we can't see or feel. And that's the culprit that's really causing the vast majority of skin cancers. And essentially UV can change the structure and function of DNA in our cells, and that's what leads to skin cancer. So when that damage adds up over time, that increases your risk. So using protection and stopping that UV from getting to your skin cells in the first place is what will help to prevent the disease.
So I might just, jump in there. So one of the things that I like to say is that the DNA of your cell is like the blueprint. So everything that happens in the cell gets, the cell takes it from the DNA. That's the blueprint. And if you're getting UV damage to that, what it's doing is making slight errors in that blueprint. So something is very subtly different each time. And if you accumulate a lot of damage, you can imagine that the structure, so if it was like a house and you'd slowly made a lot of little changes to the blueprint over time, it gets to a point where it's no longer functional. And that's in essence what's happening at the cellular level when you expose yourself to a lot of UV.
Does that mean, like with advances in, technology over time, that we can sort of pinpoint, what proportions of skin cancers are preventable, like were caused by, UV radiation versus maybe ones that we didn't know what sort of caused them at all or don't know yet?
There is an estimate that in Australia, and obviously we have such a high UV environment compared to other parts of the world, more than 95% of skin cancers are caused by UV radiation, and that's all types of skin cancer. So it really is the major risk factor. But then on the flip side, the good news is it's largely preventable with good sun protection.
And David, I suppose, from sort of the one perspective, if I get a skin cancer, can't I just cut it out?
Yeah, well, that's a common thought process, and one that I'd like to dispel, essentially. It's that sort of idea that skin cancers are not a big deal and, we really don't need to worry about them because they're very easily managed. And look, it's true that there's certainly some skin cancers that are easily managed, but one thing that we also know is that at a very early stage, some skin cancers, in particular melanomas, have the ability to move to other parts of the body. So that's really when cancers can become very dangerous, when they've established these outposts in other parts of the body that potentially life-threatening. And it's not an uncommon occurrence. In my own practice, I essentially subspecialize in patients who've had disease that's moved from the skin to elsewhere, whether that's the bone, the lungs, the brain. And unfortunately, that's very serious. And so even if you get things when they seem relatively small, it can be a larger problem than that. So I really want to emphasize that skin cancer isn't really something that should be taken lightly. And as mentioned, even if we get it early, there are still some risks associated with it. And that's why prevention is ultimately always better than cure.
Sure. And does that mean if it's moved to another part of the body, that's now a secondary cancer? And I know that sort of terminology we've heard, and I've heard it, and I sort of don't quite know if I know what it means.
Yeah, no, you're absolutely right. That's usually what we'd refer to as a secondary cancer, or occasionally you'll hear doctors throw around the term metastases. So that's a cancer that's moved elsewhere, and certainly at that stage, that's when the risks of it becoming life-threatening, etc., are much, much higher.
Sure. So Heather, obviously, prevention is better than cure is the message we're trying to get across. One of the messages. So why do we need to use sun protection, and what forms should it take?
So essentially, there are 5 steps to using good sun protection. So slip, slop, slap, which is what Sid Seagull sung about back in the 80s. So that's slip, slop on sunscreen, slap on a hat. And then we've added a couple since then. So we've got seek shade and slide on sunglasses as well. And we find at SunSmart that people often over-rely on sunscreen. So it's really important to remember there are other forms of sun protection. And actually, we know sunscreen's probably the trickiest one to get right. People don't apply it correctly. You end up with really weird burn or tan lines because you've missed it back.
I always miss a bit. I think I would be an expert by now, but I'm definitely not.
That's exactly it. It's so hard to get right, and much easier to apply a shirt correctly. Hopefully people shouldn't struggle to get a broad brim hat. So they're the types of sun protection. And the reason we recommend we use it is because we do have such a high UV environment in Australia. So thinking about today in Melbourne, the UV is forecast to get up to 10. That's very high. That's on the cusp of the extreme levels which we see throughout summer, and that's pretty much all day, every day. It's between sort of 9:30 and 5:30 at the moment, and it doesn't go down again until the end of April. So we've got from mid-August to the end of April, and that's just Victoria. If you go to Queensland, it's pretty much all year round.
I know, but then they don't get our winters, so there's got to be some trade-off. When do we need to use sun protection then? You've given some times, but how do we know on a particular day what times we should be using it?
Yeah, so this can be a tricky one, and where people get caught out is the fact that we can't see or feel UV, and we think, hot day, I need sun protection, and actually that's wrong. It's UV, not heat, that's causing the damage. So we have a free SunSmart app. You can download that wherever you get your apps from normally. The Bureau of Meteorology also has the sun protection times, and that just gives you the UV level and then the times of day you need your sun protection. And best to rely on a weather app to tell you, because you can't tell just by looking out the window or by going outside what's going on with the UV.
And in the interest of full disclosure, I have been using that app. I think I told you for a good 10 years you've had it out. And as I said, I now feel smug when I go out after the time when I know the UV is below 3 and I see people wearing hats, and I kind of go, no, you don't need to wear a hat. But then I realize that would come across as very irritating. So I restrain myself.
I'm similar though. I like it when it's sort of the heat, it's still warm in the afternoon, sort of after 5, maybe around 6 o'clock, you can go out without your sun protection. And I always think of that as guilt-free UV because I don't need to get my hat and my sunglasses. And
I like that.
Heather, quickly, while we're on that, actually, it might be a good time to talk about UV index because not everybody, I guess, understands that really well.
Yeah, sure. So the UV index is on a scale from 0 to 11 plus, and there's different bands essentially. So it starts at low, goes up to moderate, high, very high, and then extreme from 11 higher. We recommend using sun protection whenever the UV is 3 or higher. And yeah, as I said, today it's getting right up to 10 and it's staying that way for quite a long period of the day. The difficulty with UV is the number on its own is a little bit meaningless if you're not familiar with the index. That's why we recommend the app or the Bureau of Meteorology, because they give the times, and that's much more easily understood from a behaviour perspective. What do I need to do and when do I need to do it? So that's why we sort of recommend thinking about the times rather than just relying on the UV index. But getting to know your UV is never a bad thing.
And I think I've noticed using your app that you actually give the UV index at that particular time of the day. So sometimes you'll get sort of the advice like the forecast, I suppose, and I'll look it up and go, oh, it's already gone below 3, you know. It's 10 minutes before the time I said I might be able to sneak out without a hat. Is that good advice to follow, or should I just stick with the main times that are given so I know that'll be okay?
The times are probably best as a reliable measure because so things like cloud cover can change the UV quite quickly. If there's heavy cloud and then suddenly it's sunny again, and we know in Melbourne there's 4 seasons in a day, so you know, it might spike quite quickly and then fall back down again. So best to rely on the times.
Sure.
In terms of where that data comes from, so the Bureau of Meteorology gives the forecast, and then our radiation agency, our PANSA, they have live UV from certain locations. So the capital cities are actually measuring it in real time. Which, like you said, if you're a data nerd, if you're interested in this stuff, that could be quite interesting. But the sun protection times are probably the easiest guide.
Good to know.
And one other thing I might throw in there, actually, just while we're talking about it. So, I mean, Heather's talked about the influence of clouds on UV, and I just think that that's an important one to touch on too. I guess that heavy cloud cover definitely does have an influence on UV, but I think in general, it's overestimated how much influence clouds do have. So there's this very common misconception where, oh, it's a fairly cloudy day, there won't be much UV, I don't need to follow the sort of the slip, slop, slap type advice. And that's actually quite incorrect. UV can quite easily penetrate light cloud cover. And so usually the index is higher than most people expect it to be. And if anything, we often see the reverse. So people have gone out in on a day that they felt was fairly cloudy, they didn't follow the advice, and then they're, you know, covered in a sunburn the next day. So it's very important to sort of really be aware of that as a factor too.
And UV,
I think my father used to tell me as a child, I think
UV
my father used to tell me as a child that was windburn. And is that the same thing as sunburn essentially?
That's a myth. That is one of the biggest myths we hear at SunSmart.
And he's a scientist. I'm going to have words.
So it's, you know, I think a really good way of thinking about it is I've never heard of anyone who's been windburnt at night when the sun is no longer in the sky. So essentially that is sunburn. It's just that you're thinking it's a cool or a cloudy day. That's actually probably when you're more likely to be caught out than when the sun's, you know, full glare. But as David says, you know, different types of cloud have different effects on the UV. We're not going to be able to tell that just from looking out the window. The app's your best bet. And also cloud can actually reflect UV too, which gives a double dose. So yeah, really important to not rely on just what the clouds are doing or what's happening in the sky, and check your UV.
Now, SunSmart, as you said earlier, has been around since the 80s. I certainly remember it during my childhood. So I suppose the question is, don't we know this by now? Why do we keep on needing reminders? Are we just really bad at remembering this kind of stuff?
I guess this one's a bit like any parent will know that you don't tell your kids to brush their teeth once and expect them to do it every day, twice a day for the rest of their lives. So health reminders are really important, particularly for something like skin cancer. When the sun is in the sky every day, we're not going to get away from this one, you know, it's always going to be something we need reminders on. And there's actually really good evidence from research as well that When we have campaigns on air that are reminding people to use sun protection, behaviours go in the right direction. If we have a year where we're not on air over summer, those behaviours dip again. So really important to maintain the message. And there's a nice analogy here as well, that I'm not sure who said this. I should probably find my reference for this because I use it a lot, but that public health is like a spring, not a screw. So a spring, you have to put the pressure on and keep the pressure on to keep it down. A screw, you screw in and leave it alone. Now we need to keep that pressure on to keep rates of melanoma down. We can't just assume our job is done. It's a long-term game.
Sure. And so you touched on earlier about how sunscreen is something that we're often very bad at using. What should we first of all be looking for in a sunscreen? I know you've got the different numbers there. I'm assuming the bigger the number, the better, but what else should I be looking for when I decide what to take off the shelf?
So at the Cancer Council, we recommend using sunscreen that's SPF of 30 or higher, broad spectrum and water resistant. We have some of the best regulations in the world. Sunscreens are regulated by the Therapeutic Goods Administration. So if it's for sale in Australia, it should be approved for use by the TGA. Essentially, if you find a formula that you like, you're more likely to use it. I think people tend to maybe wonder if price is a factor. It's not really, as long as it's TGA approved, you can buy sunscreen in huge quantities quite cheaply from the supermarket, and that's absolutely fine. But really important to remember, it's not a suit of armour and you need to use it in combination with the other measures.
And I know sometimes you hear about, chemical sunscreens versus physical sunscreens. And as we were discussing, offline the other day, you were saying that that's sort of a bit of a false dichotomy.
Yeah, that's right. So a lot of sunscreens actually contain a mix of those ingredients to prevent the UV from reaching your skin. And there's not really much of a difference. They both do the job, just in different ways. So find a formula that you like. If people have sensitive skin, there are sensitive formulas out there. And that means, you'll use it.
I actually associate, I think now, the smell of sunscreen with summer. So I've clearly used it so much that I've got that really, positive association in my mind, which has got to be a good thing. What about aerosol sunscreens? I understand there was some new research out about them recently. And look, I will admit I am a fan. They seem really simple. You just sort of spray and you're done. But am I getting a false sense of security from those?
Yeah, unfortunately, Susanna, yes, it is the answer. Aerosol sunscreens or spray-on sunscreens are really something which we are generally leaning against advising these days. The reason for it is kind of what you've described. When you spray on a sunscreen, then there's a certain amount that you need for it to be effective, and then you also need to get the skin coverage. And what we do know is with spray-ons is that people have a tendency to often under-apply and miss areas, that's probably no surprise when you think about it, because when you're spraying it on, it's hard to know exactly how much you're supposed to have covered any particular area, or if you're trying to do it, I guess one of the whole advantages, people see it as being a really fast thing that they can apply on the go. And so we actually see people getting sunburns much more often with aerosol sunscreens. And that's why we say, look, it's simpler and better to stick with your creams. You have a better idea in terms of coverage and application. You're more likely to get good sun protection from them.
And I think you were telling me as well, Heather, that 85% of us Aussies don't apply enough sunscreen. So how much should we be applying?
Yeah, that's right. That was a study from a couple of years back, which is a bit of a worry. And the answer, the broad answer is it's always more than you think. We would always recommend use the other 4 forms of sun protection first, and sunscreen is your last line of defence for those parts of skin left uncovered. But as a rule of thumb, it's about 7 teaspoons for a whole body application for an adult. So that would be 1 for each arm and leg, 1 for the front of your body, 1 for the back, and then 1 for your face, neck and ears. Good guide though, because hopefully you're covered with clothing, but that just gives you a rough idea of where to put your sunscreen and how much to use.
I suppose another thing that people often think about, particularly if you live in a place like Melbourne, Victoria, is how do you balance, getting enough vitamin D and making sure you're not putting yourself at, higher risk of getting cancer. I'm sure that's something that both of you could speak to, perhaps.
Yeah, this is a really interesting one, and both Heather and I think get asked it or have to talk about it quite frequently. Look, it is true. So I guess that for people who are not totally familiar with it, the vitamin D does come from exposure to sunlight, and that's why people ask the question: if we're trying to stay away from sunlight, are we going to get enough vitamin D to be able to perform the necessary functions in the body. Look, the general advice actually regarding this is that the majority of people will be able to get their standard vitamin D through the minor exposures which occur throughout sort of regular life. So it's actually quite a low amount that is required for you to get it. So I believe that it's actually in the order on a normal summer's day, we're talking about only about 5 to 10 minutes on just on exposed limbs, so arms and legs, 3 times a week. And that's the sort of thing which the majority of people would just be getting anyhow. So really, it's no reason for you to reduce or, not apply your sunscreen or follow the sunscreen, SunSmart type measures, because your general incidental exposure, even when you're not trying, probably covers that. And I suppose, sorry, you go.
Yeah, what about during the middle of a Melbourne winter where we probably haven't got our limbs very much exposed because it's freezing? I say this as a girl who grew up in a warmer part of the country, in Perth. Do we face a problem then of not getting enough vitamin D during that time of the year?
Look, there can be, and I think specifically there are a small number of groups of people who, for religious reasons or other reasons, stay very well covered, and those are people who are at slightly higher risk of vitamin D deficiency. Look, I mean, in those settings, there's also other ways to get vitamin D too, it must be said. So, I mean, vitamin D is in a number of regular eaten foods, eggs, and a few other things. So I suppose that there is exposures otherwise, and there's supplementation which you can take as well. And so I think that's actually a better discussion to have with your GP. If you feel that there's going to be concern, they can actually check what your levels are, and only if you really truly are proven to be deficient, then get some advice about specifically how to handle that. Heather, do you have any other thoughts related to that?
Yeah, I'd just say, just to add, the time taken to get your vitamin D will always be less than the time taken to damage. So, skin gets damaged after the vitamin D has been made. So there's really no benefit to staying in the sun longer. Unfortunately, we know that people often like to find the loophole in health advice. So a glass of wine that's got grapes in it, surely that's good for me, similar with...
Oh, look, all the studies about dark chocolate being good for me, I know is the top science. I believe all of them.
Exactly that. So I think we just need to be careful to remember that, for those groups. So David mentioned people who cover their skin for cultural or religious reasons. Similarly, people with darker skin types. And also, if you just can't get out that much, maybe you've been in hospital, maybe you're in aged care, that's the types of settings where this is probably more of an issue. And that, in that case, we'd say have a chat to your GP.
Now, you mentioned earlier, Heather, with the app that often we have the high UV where you've got to limit your being outside during the summertime. But then after April, I've noticed, and also from my use of the app, that during winter, it's not as much of an issue in southern parts of the country like Melbourne. Does that mean we can go outside and spend as much time as we want in, maybe not in freezing Melbourne winter, but, what sort of precautions should we still be taking at that time of year?
Yeah, that's right. So if you do have the app and you check your sun protection times, you'll notice that from pretty much May to mid-August, they're the times when we really don't need to be using sun protection in Victoria. Remember, though, if you go up for a bit of sun in Queensland, you will still need to use sun protection. So make sure you're checking the app for the location.
Changing your location, yes.
That's it. But essentially, that's a really good time to be getting out and not worrying about it. I mean, we would never say to avoid the sun. We'd say, it's important for health as well to get exposure and to get outside and exercise. So do that safely. Essentially, use your sun protection when the sun protection times are on. But yeah, in winter, we get a couple of months off in Victoria.
Fantastic. Now, I know this is one of those sort of loophole questions again, but how often do I have to get my skin checked? Do I have to go and get it checked every year?
Yeah, and yes, you say, a very interesting question, and I think one which is worth us spending a bit of time on. Skin checks are something which are necessary for certain groups of people. But again, I guess is there a blanket rule that every person should be out getting a skin check regularly? The answer to that is actually no. It returns a bit to where we started. We talked about how there are groups who are higher risk of getting skin cancers and risk factors which are greater. And so people in these high risk groups are the ones that we recommend. So in actual fact, they're people who've got the light skin types. who had heavy exposure to the sun when they were younger, so people who are older, so white males over the age of 50 in particular. And then there are groups of other people who maybe have reduced immune systems, which increases the likelihood of skin cancer, or previous history. So these are the sorts of people who we say, yes, we really would suggest you get seen by and reviewed by a skin specialist once a year. For everybody else, then what we usually advise is more about knowledge of your own skin. So basically having a regular self-check monthly is what the current advice is, of where you examine your own skin in a full-length mirror with good light, so that you see if there's any changes, and if there's anything that's concerning you at that point, you would seek advice.
Would you still recommend someone with darker skin, say, to get a skin check every 2 years or something like that, just so they, even if there's things that they miss, they're still getting sort of regularly an expert casting an eye?
I guess that, people with dark skin don't necessarily fit that sort of high risk group where we would suggest that they need to have a regular skin check. So again, I suppose it comes down to, if they have pretty good knowledge of their own skin, then then they can seek advice if something's worrying them. But I guess that there's no reason why they couldn't have some other reason that's worrying them. So for instance, if someone else in their family had difficulties, that puts them into that risk group. If they had an unusually high exposure to the sun, then that also increases their risk. So it's a little bit tailored, actually. And I suppose if you're not completely sure, that is, again, something that'd be worth discussing with your GP or a medical professional to get a better idea of, individualized to yourself, what is the needs to follow up.
And just to tease out a couple of the things you said there, David, when you say an unusually high exposure to the sun, is that obviously people that work outside, or how many hours is that? Do we have a way of quantifying that? This is the chemist in me. I like numbers.
A number, yeah. Oh, well, that is actually an interesting question. I'm not sure that we have an exact number that we would advise, but partially we do. I mean, one of the things that is definitely associated is sunburns that you've had. So periodic sun exposure and sunburns does have a very strong correlation with skin cancer. So often we will ask when we're taking the history, do you remember episodes of significant peeling sunburns at any point in your life? And if the answer is yes, that puts you straight into that category.
Yep. Unfortunately, I do, but I have gotten much better in as I've gotten older, thankfully. The other thing I do want to touch on, you were saying that people who have immunosuppressed could be more at risk of developing skin cancer. So is that because their body can't deal with the damage to their cells as much as someone with a healthier immune system?
Yes, in a way. So the immune system is actually an amazing thing, which we continue to learn more about as time goes on. And I think in the early days, the belief was it only fought off bugs from the outside, so, infections from bacteria and viruses. But it's become increasingly obvious that in actual fact, it has a job in screening cells as well. So screening your own body cells. We talked a bit earlier about how UV damage is damaging the blueprint of your cells, so that eventually gets to a stage where they're sort of going rogue. And in actual fact, what the immune system does to a certain extent is looking for these cells that have gone rogue or have significant damage to their blueprints and say, you are a danger, I'm going to get rid of you. So if people whose immune systems are less functional may miss that sort of process, and then therefore cells may slip through the gaps. And I guess that's also at its basis a little bit of what underlies immunotherapy, which currently exists.
And there was something else I wanted to touch on earlier. We were sort of talking about a history of sun exposure as being a risk factor for developing skin cancer. And I think I remember hearing once, and it's one of those things where I can't remember who said it to me. So hence I wanted to run it by you both as the experts, and you can tell me whether there's truth to it or it's a load of rubbish. That's sort of like, it's the history that if you've had a lot of exposure like earlier in your life, that's almost the most crucial bit for figuring out if you're going to get skin cancer later. It's kind of that earlier exposure that seems to have the most impact. Is there any science behind that, or am I completely making something up?
There is, and that's why we have a schools and early childhood program at SunSmart's. So the first 10 years in particular are really vital because children's skin is more sensitive than adults. So exposures are important, but it's really also important to remind everyone that it's never too late to prevent further damage adding up. So
Sure.
even if you're, whether you're 16 or 60 years old, you should be using sun protection, because any additional damage, even if you've had a diagnosis, actually, you can prevent further damage adding up to increase your risk. So sun protection really is for everyone. Another, just to add, I know you were mentioning outdoor workers earlier as well. So we get a few months off in Victoria from the sun protection times, but we do recommend that anyone who works outdoors uses sun protection all year round, just because their exposure over time is so much greater.
So it's like that cumulative damage that you're referring to. It's, the little bits that add up over time, and the more you can cut that back, the better off you'll be.
That's exactly right.
See, as a child, my father used to bribe me with bakery sweet goods. If we went to the beach early, we'd go to the bakery on the way home before breakfast, you see. So that's why still now going to the beach in the middle of the day is something I'm really unfamiliar with, because it's something that I've never done.
Bribery. Maybe we should put that into the next NHMRC guidelines.
Look, I think baked goods help in every situation in life, don't they?
I can't disagree.
So on the topic of age, you were sort of saying earlier, it's never too late to start. So if you're someone who maybe hasn't had as stricter parents as mine, or maybe your parents weren't as good as bribery, I'm sure my parents aren't watching this, so I'll be fine. What are some of the key things you should be looking at doing to sort of improve your sun protection?
Well, I guess getting the app. I know I've plugged it a few times, but it's never too late.
It's free, people.
The app. So that's really where the knowledge starts, right? So when, what you need to do, when to do it. Then I think really invest in some good sun protection. Get a good broad brim hat. Don't rely on caps. I think we see a lot of men in particular think a baseball cap will do the job, and unfortunately it won't. It's leaving the back of your neck, your ears exposed. And we know in men in particular, many skin cancers are cut out of the top of their ears where they haven't been using.
Oh, okay.
So it's a site that people forget the sunscreen on as well. So good broad brim hat, rashy for the beach, invest in
long sleeves, I'm assuming. We don't want to.
That's right, yeah, long sleeves, and the longer the better. So it's really about finding sun protection that works for you, that you'll wear, that you enjoy using, and then you're more likely to actually make it part of your routine.
David, was there anything you'd like to add?
Oh, well, I was just chuckling because I completely agree with everything Heather said. And, certainly in terms of treatment, I'm constantly treating people's ears who've been exposed. But the irony was just because, even I occasionally get around with a baseball cap. So I was just thinking I might need to update the wardrobe.
Just explain that it's for science. It's the best health advice. I was wondering also if you had any specific advice around sun protection for pregnant women and also newborns. I'm a new aunt. My niece turns 3 months old tomorrow. So I know she is someone who's got way more sensitive skin than I do. So it has to be protected at the moment. But sort of what general advice can you give for people in that situation?
So we would recommend for pregnant women, their immune systems can be a little bit down. So again, really good idea to use sun protection more vigilantly, perhaps. And then for newborns, we would say keep them out of the sun. We don't recommend sunscreen use for babies under 6 months. Really important to make sure they're just not in direct sunlight, because they are so sensitive.
Though they're very cute at that age, I have to say. But see, I'm an auntie, so I go home when she cries, so that's fine. What about any other resources to help to sort of know when to enhance sun protection? We've talked about the app. Are there other things that people can look at to sort of make sure they're across what they should be doing at particular times of the year?
Yeah, so at SunSmart, our website is sunsmart.com.au, and we have a whole host of resources there that just hopefully will meet the needs of whichever category you fall into. So for schools, for workplaces, all age ranges. So if there's anything in particular that you're looking for, check out the website. And we also have someone who can answer queries on the phone as well. So if you have any questions about anything SunSmart, you can come to us.
One thing I feel I've heard a lot, I'm not a person who tans, but I hear other people do, does a tan protect your skin? Is it healthy, or is that really a myth that we've sort of been perpetrated through the media?
I think Heather and I are both very clear on this one. Unfortunately, there's no such thing as a healthy tan. A tan is really your body's response to damage. So it's realizing that something is going on that's not quite right. There's damage occurring, and then it starts trying to produce this tan, which helps to protect it a little. But really, it is actually an outward sign that damage has occurred. And so, yeah, so I think we're pretty strong in trying to get this message out, because unfortunately, particularly in Australia, obviously there's very different perceptions of what a tan suggests.
Does that mean that people who tan really easily, like my brother-in-law does, does that mean that maybe people like that need to spend a bit more time on sun protection because they could be doing themselves more damage than perhaps they realise?
Yeah, that's an interesting one. We have got some evidence that actually the fairest skin types, because they only burn and don't tan, which is something you might be familiar with, I certainly am, essentially we're more likely to use protection, right? Because we know the consequences and how painful it is. And also there's no gain at the other end. It's just...
No, there's just lobster. Yeah.
Whereas if you do get the tan, then perhaps you get that false sense of security, which then means that you go too far and, now you've got a bad sunburn. So yeah, the tan, I mean, the equivalent of a tan, I think, is about SPF 3 or 4. And if you think we recommend 30 or higher, that's really, really not going to do anything much to protect you. And it just shows your skin's already been damaged and is trying to prevent further damage from adding up.
I was sort of interested to touch on sort of away from sort of this discussion directly about prevention, but you've both worked together for a long time over the years. And, Heather, you're coming from more that policy health promotion background. David, you're coming from the medical background. I was curious to know what you've learned from each other through doing this work over the years. Whoever wants to go first.
I can start. I think that's a really good way of putting it, Susanna. So I think the way that I work, or my focus of my work, is on sort of population health outcomes, and David's is more at the individual patient level, but you can't really have one without the other. I find really useful is, if I need that clinician's perspective, I can just pick up the phone to David, and I think the angles we're coming at the same problem from are quite complementary, so it's quite good to share knowledge and have that comprehensive approach to the same problem, essentially.
Yeah, look, I couldn't agree more. It's really, I think, a great thing to be able to see the problem from multiple different angles, because, it is both an individual and a population-based problem. And sometimes, I suppose, when you're sort of, in the trenches or doing your particular line of work, you start to become a bit focused on one particular thing. So I think working together with Heather, it gives me this great ability to sort of still keep a good eye on what's going on in terms of the population type prevention issues. And also, I guess, just in terms of the traits, in terms of public education and whatnot, events like this, I feel like, I've certainly learnt a lot from working with her in those things over the years.
Fantastic. And a question that's come in, what about protecting our eyes from the sun? Now, obviously, putting on sunglasses is now part of the slip, slop, slap, seek, and what's the last one again?
Glide.
Glide, thank you. I knew the first three are burned in my brain, but I may need a bit more exposure to the last two. Should we be wearing sunglasses all the time when we're outside and not just when it's sunny? Or again, does that sort of, like, I've got blue eyes and I feel like as I get older, I notice they're more sensitive to the sun almost. So I'm usually reaching for my sunnies when I go outside. But can we give blanket advice on that as well?
Just pardon me a moment. My laptop is not plugged in and about to die, so I'm just going to have to duck it momentarily.
All right, I'll take this one then. So yeah, your eyes can certainly be damaged as well as your skin by UV, and there's a lot of different eye conditions that can be caused by UV. So sunglasses are an absolute must, and we recommend using a wraparound style, because then that protects sort of the sides of your face as well. But also really good to remember that a good broad brim hat will reduce the UV to your eyes considerably, as well as sunglasses. So it's not an either or, it's using the measures in combination.
And for people like me who wear glasses, I have had problems because, of course, we're wearing masks at the moment in Melbourne, and I can do the hat and probably the masks, but I probably can't do and the glasses as well without being able to see where I'm going. So it's good to know that a hat is also going to help me in this situation.
So we found a good tip actually for that with sunglasses or your glasses in general. If you put a little bit of washing up liquid in the lenses,
that stops it fogging up.
Clean it off, stops it fogging up. So
there you go. We're learning about all sorts of things. Look, a final question for you both is sort of a bit of a wrap up. If there's one thing you'd like to know, like the public to know about skin cancer, what would it be?
Well, I'm happy to start. I think from my perspective, it's basically that skin cancer is no joke. I think if anybody was to come and spend a single day on the skin unit here at Peter Mac, you'd realise that some of the consequences are immense. and dealing with those, you know, on people every single day. Some young, some old, all, you know, who've got things that they want to be doing with themselves rather than being here. If you just take it seriously, ultimately, as mentioned, prevention is better than cure. If we do things right, then there's no reason that you're ever going to need to have to cross paths with someone like myself. And that's where, you know, people like Heather's and their amazing work is really useful from that perspective.
Just to add to that, I'd say if skin cancer prevention was a drug, it would be a wonder drug, miracle cure. You know, it really, really has the potential to reduce skin cancer rates considerably. So yeah, as David said, prevention is absolutely better than cure. And I think the one thing I'd like people to take away is that it's the UV, it's not the heat. Don't just rely on your sun protection on hot days. Check the UV, get to understand when the times of day are that you need to use your sun protection, and rely on that instead of the heat.
Well, look, thank you both. And thank you both for speaking to us this afternoon and for sharing your insights and experience, and of course, all the great work you and your teams do on skin cancer prevention. And to everyone who's joined us this afternoon, thank you for tuning in. We'll be back next Thursday with another Facebook Live. Keep an eye on our Facebook page for who we'll be speaking to then, and hopefully we look forward to seeing you online